Two marks question of NET Life Sciences for this November examination. Uh, Aromatase enzyme. It is also called CYP19. The naturally occurring estrogens are 17 beta estradiol, estrone, and estriol. They are secreted primarily by the granulosa cells of ovarian follicle, corpus luteum, and placenta. Their biosynthesis depends on the enzyme aromatase. This is also called as CYP19. The aromatase converts testosterone to estradiol and androstenedione to estrone. These reactions also occur in fat, liver, muscles, and brain. Laron dwarfism. In such dwarfism children, the plasma growth hormone concentration is normal or even elevated, but their growth hormone receptors are unresponsive due to loss of function mutation. Laron dwarfism is because of the growth hormone insensitivity. Growth hormone is present, but receptors are not responsive. In such cases, plasma IGF-1 is markedly reduced and also IGFBP3. This IGFBP3 protein is the receptor of growth hormone. Paraganglion. Paraganglion, these are the small group of cells resembling those in the adrenal medulla. They are found near the thoracic and abdominal sympathetic ganglion. Cholesterol desmolase or side chain cleavage enzyme. A steroid carrier protein transports cholesterol to the mitochondria. And in the mitochondria, these cholesterols are converted into pregnenolone, and this reaction is catalyzed by an enzyme known as cholesterol desmolase or side chain cleavage enzyme. This enzyme involved in steroid biosynthesis, and it is the member of the cytochrome P450 superfamily, and it is also known as CYP11A1. Star protein, steroidogenic acute regulatory protein. Star protein is essential in the adrenals and gonads, but it is not useful in placenta for the movement of cholesterol into mitochondria to reach cholesterol desmolase, which is located on the matrix side of the internal mitochondrial membrane. In its absence, only a small amount of the steroids are formed. A loss of the function mutation of the gene for the star is the cause of severe congenital adrenal hypoplasia in newborn. Ethiocholinenolone. Ethiocholinenolone is a metabolite of adrenal androgens and testosterone, and it causes severe fever when it is conjugated, and it is called as ethiocholinenolone fever. Insulin-resistant diabetes mellitus. Many products of protein catabolism, particularly of amino acids catabolism, these are converted into glucose in liver, and with this production there is hyperglycemia, and decreased peripheral utilization of glucose may be sufficient to result into insulin resistance diabetes mellitus, particularly in the patient who are predisposed to genetically diabetic diseases. Hyperlipidemia and ketosis are associated with the diabetes, but acidosis is usually not so severe in the case of insulin resistant diabetes mellitus. Nucleus of Tractus solitarius. Nucleus of Tractus solitarius is the part of the brain where the barrier receptors exert an inhibitory input via nucleus of the Tractus solitarius. P cells or principal cells. The epithelium of collecting duct has principal cells and intercalated eye cells. The P cells are involved in the sodium reabsorption, and vasopressin is stimulated water reabsorption. Eye cells, these are found in the collecting duct and distal tubule, and these have more microvilli, cytoplasmic vesicle and mitochondria, and these are mainly concerned with the acid secretion and bicarbonate transport. So one important point is that P cells and I cells. P cells are for sodium and water, and I cell for bicarbonate transport. SGK, serum and glucocorticoids regulated kinase. It is a serine threonine protein kinase. The gene for SGK is an early response gene and increases the epithelial sodium channels ENAC activity. Cohen syndrome. This is due to the primary adrenal disease, primary hyperaldosteronism, that is Cohen syndrome, such as an adenoma of zona glomerulosa, adrenal hyperplasia, adrenal carcinoma. Excess mineralocorticoid secretion leads to potassium depletion and sodium retention. One important point, sodium, depletion of sodium and retention of sodium, usually without edema, but weakness, hypertension, tetany, polyuria and hypokalemic alkalosis. It is called as hyperaldosteronism.